Chami adaye ho akwa ba ye di apomuden komo no bremo ansana no ma yenda nyame asema adofo eni ma omu so aninye se nyame ahwe onso ade afi aka wo mu emfi ho enti Superintendent Sandra Akosatewia we head ewo legal and prosecution Ghana Police Service tema ene wa woda wo bra lawyer TK champion TK say yen kan so ma happy birthday or say nyame se onhwa na onye okese na Irene Omane echa Wokofodua Technical University onso ene wa woda nti Michael Akrofi ma happy birthday Superintendent de na masen atwera be we dey free COP 30 hunu Papa me tell nkan che you and happy birthday to Superintendent Lawyer Sandra Akosatewia. We are popular pa head of legal and prosecution unit tema from COP 30 hunu o say nyame se onhrawo. And Sadiq Asa also unisi was Sleeky Promotions and events agent for MTN Ghana Western region. And so eneye wa wudei yenu abema Daniel Edunkan say o ma happy birthday we die minua paaya o say 3rd August but 3rd ninya mai but mini kan emma ne boss vice president me mano happy birthday in advance unu ansoma wa obede akase wonye into your excellency happy birthday in advance from wodjuma ye for ne baako ye friend ne paaya. Okay, it is a see ye kwan ni mu atene na ye da Zuma Trading Company Limited as say body toothpaste papa ba and na ye sewe akokodro so ye kasa akokodro so if we say ye sia ye fita ye sia chinam na hodin abam moja so mfim ni enum nso de aye hwaman kasa ahodin na ba ye enum nyine. If you say Zuma Trading Company Limited and or their portion papa ba unyanya bia wo yakache si aidie eno a Shinex KC Colodent toothpaste and a KC Cologel toothpaste and a Nimodent neem toothpaste eno obi yusu enti wonso yusu bi wo de kososhe na wo be di ho adanse amafo yeto enti wonya sika kakra wa wo pa adwuma no kotubi na beton fe wonum 0262 210660 and 0202 018615 now so to beton Amen Scientific Care Ban in the alternative medical hospital so any or say yade bi o pese wo ha wo no obi benya we fi yade fa no kosamai kosamai ne ma amen for na wo mo bedi wakagina mu se obema yade ani ewu obema yade afa fi se obesa o yade amwo gina wo na so kireben enkran Kumase Takrade Tamale hoi wa sunyane hifa na emenini emi wo bebia fe wonum 020 722 9505 and 0244 227192 and 0277 001234 na eminenche onkrabata benwo na won so wakwa akogye ayarehwepa efi omunche na ho ato na enigye aba ena ye kasa de afa covid ya ho me economic kan say covid ya sem de entumi nkan wi obekasa ya na enye ye the other health maka covid enu abdata maka covid said ye boboba no se ya ncha de si wo musi wave nti eboba se po asoche no oni break enti se ya anyere ye ho na ya na ye ho so na ye ni enhyehyɛ ahodo ni so a ebe ya asem amayen pa Ghana Health Service for akache na anu so mampeni akache ze 3rd wave na mu ene ewe enene nansa ye hwe dia ye betumi aya afa ho se ya ye famu die enura ye hwe se baabi a wo wadwuma ye mu covid brain mu no sunsun so enya wo utri mu ana wasetena mu ne psychological effect e wo so ne de obetumi aya afa ho enipa ko bi wo ho a wo mo so boa ema sa covid ya die yetumi sa nanso hwan na hwe oyarefo na hwan na doctor yare a ohwe no wa hwe ani aka na wo mu de yegya wo mu asi no so bebrebe nyina wo mu ho a ene ye de eko enti wo mu so adwuma ye mu no load eba wo mu ho work load no te sen say ye nurse, say ye lab technician, with a lab scientist, say ye doctor ni or consulting room, obi o wapum di atena ye ho. And yes, I do your center, and be a baby in your center, and so obi di bibe koho. And now so say, ya dear fufu bibem. Dear in a woman so ye, I found an ankasan so, woman so well being at a saying. Dr. Winfred Bar, Greater Accra Regional Secretary, Emma Ghana Medical Association, a doctor phone Kabumkwa, a one craheno, second no, secretary. Doc, Aquaba, a human muti saying, Yamiado, ye then Yamias, ye damwa senso, Semunya, Yasun den Kakra, my boy cocono cry, and so ba a G say kiku near Bamho, be over be answer, and I'm a business say. Mojuma muno at the science see and say current situation of COVID muno at the same also a doctor for muhune say.
Me da si na me chia etifu nyina. Na senya wo kan ye no, ye kan third wave no. Senya why splitting fine pa. Wave no e ba untimi stop no. But onyema bia ye betimi aya e be slow down wave no.
Okay.
Na sisi anu senya okaya no ye wo cases not those wo hospitals no. Mimi ye juma wo kolebu and I can tell you say we are getting overwhelmed. First no, by 1 month na your COVID center there will be 2 or 3 patients or sisi anu ohayema.
E ho ne fa nipa say.
Timi fa nipa 18. Ayema. 18.
Yes. Okay.
Ayema. Ena omo amoba ye wo nipa bebra ye manage omo wo fie. It is a ebia unya na ebia oxygen saturation. So ebia ye di bibi be si wa na ye hwe amount of oxygen I won say eh okay a etimi manage wo fie. Nti omo so mo na omo wo severe moderate to severe disease.
Okay.
Not just that is just the tip of the iceberg. Pachowati
Matthias say che so mo hospital ye mo de na mu eden. Nti de mu nya den ye betia ka say otina fie ye we ji wadu ye say.
Na de bia ye from na ye bisa okay we saturation it is saying na ye hwe.
Okay.
But sisi ye hu say omo ba hospital omo yare pa. We share first wave now and every wave let me say every wave I ba no na severity no increasing. This third wave no nya ye hu say omo ba omo wo ho no sisi oxygen no omo hia no more.
Wow.
Let's just say lung infection even more severe. So we are seeing more severe cases. And senior omanpenika
na general hospitals na say centers ayashe the years you say isolation centers no na mo severe cases.
No, the severe cases were baby especially in Greater Accra and Greater Kumasi area. Na severe cases no I mean those are the hot spots. Inti senior meka no they can present in any hospital, omutimiko anywhere. Just say omuko hospital be na omuni treatment center. Then they refer to your different treatment centers who Accra and Kumasi and other regions. Then they refer them to those places.
Okay. Now, Osha, then I'm cases now shows.
So, in fact, this is our third wave. We know what drives it. At least the first one we didn't even know.
Second one, I say you. Anymore.
Second wave, no, say now that one started in January of this year. Before that, no, elections, November, December, and the Christmas festivities. So we know the things that bring them. Nyamiadom first wave, no, by March, April, na abafo. Then we lost guard.
Oh.
We lost
guard. And you people too went to sleep. You didn't come and remind us and educate us that, hey, don't lose guard again.
I say, but you can also say, bremo. I mean, there's genuinely what we call COVID fatigue. But we can't be fatigued. We can't afford to be fatigued. Yeah. That was it. And now you know that prior to this, there were some gatherings. I say, we call funerals. One funerals in Kofu share nose masks. Social distance needed. Oh, David. Now, say my parents say you can have funerals with but you work of funeral beer when who says social distance. It's difficult.
And the times.
It's difficult.
Nose mask no cry. Wow, pa na wash wa dey say say nya akra na be mfo na say awo ye wo ho ana na yi na tie yi ati na wo she nose mask.
It's true. Who call outside Accra now we share nose mask. You are weird. What you are saying? So we know what brought it. We are not adhering to the protocols. Obia.
Wow. And yen hwe say yen ni so a eba ayaresabia ni sunsanso te say mam say ekoba say epeja nsunsanso be ne benya wo ayaresabia so.
Sisi apeja pa. Senya meka no mami nche. Sisi we are even sometimes struggling with oxygen. Senya meka no omu yare sisi with the Delta variant. We say most of it is driven by the Delta variant. They are very sick. Sometimes some of our centers get short of oxygen.
Wow. And
that's one of the challenges. Ukaya, when the third wave in India started some few months ago.
Yeah. Now man for oxygen need the coffee. Edu be ko munya bi mpo.
And if you don't get oxygen, the people will die.
Wow.
That is what I'm praying, say. We will take a cue and increase our oxygen supply to the centers.
Oxygen ni bi ni.
Mpacho and na tank no mo. Well, na you will be so you different walls, pipes, or walls no mo. Wall. But you must have a plant to supply it.
Okay.
They are there, but because of the increasing cases, no near one and so, we need to we have to increase. That's one of the things we have to do.
And what did you need you?
Yes, yes.
Say more money panel from our home. Say oxygen you the and say
no. For what only COVID, only lung infection. The normal oxygen in the air is okay for you. But sir, who are lung infection, who are COVID, lung infection, then you need more oxygen to keep your body going.
Wow. No oxygen you enough for horses here na shortage aba.
Well, some of the centers, sometimes we get shortages. But we do our best to try and get it. What we have to do now is to make sure that we have enough oxygen supply for all our centers.
I see. And yen share see ya me na me say nkai ba say kosora. And I say akosoro dada.
Akosoro.
And na me bi say oxygen so say o see enya bi my centers na. Enti apomden adwuma efo a ana say yen health facilities ahodo no. E dia na omu be hia abre yi mu.
Okay. Enti that's it. First one say me kan oxygen. We need it for some of the patients.
Moye den na munya.
Enti they have people who sell it.
Okay.
We have people who deal in just oxygen plants.
Okay.
Some of the factories are their productions, they have oxygen as a byproduct until we get it from them.
Okay.
Some of the hospitals also have plants that generate oxygen. But like I'm saying, if maybe you were generating, let's say, a certain capacity before COVID, now the demand has increased. We need to increase our production capacity.
Okay.
Then secondly is intensive care units. So when your oxygen is going down, sometimes even giving the oxygen is not enough. We need to put them in what we call an intensive care unit. ICU. I'm saying it be not omusho or when.
There you move baby oxygen ward. And
no in the ICU you want friend ventilators. Ventilators no. When we can intubate you and put it's like an artificial breathing machine. When your body is tired, when your body is tired, we can take over your breathing and let the machine help you do the breathing so that your lungs will have time to heal. That is the last part. If we don't have that, we will lose a lot of people.
Nagana ventilators in here will be.
This is
Oh, yeah.
With some of the centers, but not all the centers. But if the numbers increase, we may not have enough ventilators for everybody who needs it. So we need to prepare. And like you said, we went to sleep. Probably we thought that the third wave no end to year. But unfortunately, no about.
First buy, second buy, third. More facilities ahodo no. Yesua bibi ya ho boa te say emmeye te say India mfanto wane yi. Mo wo niama na mo de eboa yenya ni nyina de nanso akyerɛ yɛn bibi first and second akyerɛ bibi nti bia first yɛ wɔ one ebenya one na two bi aka ho one box a ebenya one box bi aka ho nyɛ bia 20 boxes na ego ba yenya 2 or 3 ka ho a nyɛ hu sɛ o ya boa yɛn ho kakra sɛ ɛyɛ kese pa yɛn so ya ka de ana sɛ de yɛ de bɛko yade no ɛwɔ
well and that mean to me come for the whole of Ghana.
Okay.
Mean to me I can say for baby I mean me omo the ventilators omo the biaba recently we are installing them.
Okay.
But I don't know about the rest of the country. I know they mean to make
ventilators near one of eniama amuhia no.
Exactly.
Niake kanu so.
Niake kanu so omo brain bi.
Okay.
But nyame can say for now it may be adequate, but we are projecting that in the next few weeks it might increase.
I don't know ya mo project sir. Mo kan mo tuye for ye tie ye di nhihye ye so. And I must still ebe pagya ansa na aba form.
By all means, I didn't the static rises. I said okay, it's a wave. Static rises are economy peak na aba form. Now we show US ni India mo. I mean, once it starts, no, you are just doing like firefighting. It will go up, but as to how far it goes, no, it will depend on us.
Okay.
We can limit the peak of the wave.
Okay.
By adhering to the protocols and by the way we also manage our patient. But sisi akra unna kroma. Microphone time share we know.
3 days here be kan ye nyina echi.
Oh. I think first no send na police for no ho na yetimi chiwu now. I think we need to enforce the rule. We need, if you just tell people where your omuka so some people crash see akra they still believe say there no omubwa.
Asem.
I think it's time, say, the police and the law enforcement bodies will get on the streets again. Because near hospitals now is getting worse.
Not just say yajin se mukra. Nti say obi ba hospital then no looking out for.
Okay. Nti sisi no like omapenyika ya no we have started putting in our triaging system again.
And
okay, into Uber. You be bisa before I will call hospital no cry you microphone be bisa asem. So who was symptoms via say COVID. Now you say okay with the vagina hands. Now you some further inshishemu. Before you go into the normal people, the other people. Into by doing that no you to me restrict the possible spread.
Okay.
Then after that, no, we test them. If you are negative, then we know what to do. We have holding base. Until those you suspect say, ebi awe no etimiya COVID na edi omo ato. You be treat omo, but those who go there no, they protect themselves, the health workers, so that omo nya. Yenye sa there, a lot of health workers will get it. Because na say crash symptoms no, and this first na, na ni twa nya kata na obawa na we. This sometimes be better. Oh, I'm feeling tired. My body aches. Nah, yeah, COVID.
So is that something when so it's a malaria so?
Yes. It's a malaria so. We have a high index of suspicion now. And triage holding base.
Okay.
Then we test. Now the only thing is the testing. We need to work hard so that results no be buying them.
The test na results no it
depends on where you do it. To me, you're private. Some place can even give you in 4 hours.
Oh, okay.
Some will give you in 12 hours. Yes.
Okay.
But the government facilities there now with the increasing surge, sometimes 3 days, 5 days.
If it's a nipani doors. Test no more
run
any doors.
Free. But so call baby private utia there. Utiminyano in the more scan we advise them to do it
private.
Now in tech.
Okay.
So those are the things we are doing. Then we are also increasing capacity. But the way it's now it may affect healthcare because we need more people to attend to COVID people. Let's just say the stress on the healthcare system will also increase.
And Nkaubia obeshe outpatient for anase obeshe yare fufo no ya friend no say bra COVID side yes I are for no come be check ye nya kwan hwe omo
ntem we are going back to the sister say so unya we be member hospital and as say you some online platforms are yetimi consultation
okay
until we are encouraging send your man panika you know using virtual platforms even for workplaces.
No government hospitals no more obetimi ay consult won say nipa dodo na so mo omo ho saa
I know yes I mean it's a dicey one those who cannot afford those things they can still come but we need to just keep the protocols and make sure say we follow them but it's getting and that's so he said if you don't really have anything to do out there na fee na I didn't it's a wunya
said the who kind na to say last year around this time no I ba for no sad situation ni mu ni asan akoya na
sisi west
utu yakuma
me can no cry natural
I see but mo ankasa no nso yesi mu nso mu jeja mo ho mo no apomuden adwuma efo na no na metie station foforo and obi say oko hospital ewo Greater Kumasi Mpotemo baby oko ye no na o hye nose mask o kasa doctor na say madam you nose mask na kasa na yebewu anke nyina yewu da yebewu anke nyina yewu da ero yi nose mask no enti ai te say mo nso magugu niema mu sesi afese wo twam akọ ura hospital wa ye be kasa kokronsa ana se obi be check o temperature no ai se obedu ho no mo ye sa aniama no omo nhye da ni ho enti facilities na kasa nso moteda kakra na matiada
yampa I'm say we all went to sleep and yet hospitals no pe and you first no who call ejuma bi ma see wash your hands they have all these sanitizer after some time you know all those things because people thought that we have overcome and really it got to a point where we didn't have a case if I hardly get cases and so we all went to sleep but I know said not Ghana Medical Association we always anytime things get down you can't almost say let us not sleep we are always putting but I think we all go fatigue a bit
enya asem kitwa ye kan dia na ebe yen so amanfo so mfa obi ni aha kakra bi posi o me ba hospital ti afo be na hospital won so aye ma say tam cases nko a nti ebe dey na ho nso nye flooded
yes nti na ye kan say ebia wa unim say why stress and one day and pa go headache and when you say obeko hospital just relax me can say treat yourself you say make an rest in bia then you can maybe go to a nearby clinic now at this time no I will advise say you go to a place that is not too busy
okay so
that on be sure bet me afford the private crowd call home where people are not many so doctors they can call them so we will give you advice but say I didn't get serious now you have to go to hospital there don't stay home
maintenance but so wait me afraid doctor no afraid no wait me aye no online
and you were online platforms for even video consultation until we will need to take advantage of those ones
I see and you be I said the okasa ye hu kra chen ye first wave no yenye contact tracing ya na ye be ye ne saying so
yes until senior man panika you know the Ghana Health Service they started the contact tracing
I see
say will be a positive they will do contact tracing and try and then if we don't do that trace test and treat say anya no say we can wave no peak no e be cause rosa
say the okay na say lockdown being so any am kwan mu ana
it is possible most of the countries who went to the third wave they have to do some lockdown but you see lockdown is not as simple as it is especially in a low middle income country like ours now etimi hard dream pa etimi scan ni ho na it can I'm sure say before my people call for that not just say we don't have anything else to do
you need choice
we need to adhere to the protocol so that Andrew honor
Mami musa man for questions on one Sunday be busa say mo so am wo hwe ye Ninsun so wo musono it is saying tell them about Fijils on the Facebook name no. Auntie, please, I'm in the nursing training college. We haven't received our allowance. Oh, sir. Anyway, the doctor and I may be sanama. Abamu for ne ba wate. My mention why no what have you. Citizen Francis, the COVID is still with us. The spread is high. Wear your mask. Wash your hands with soap and running water. Use an alcohol-based hand sanitizer. Keep safe. Audiophobia. Say, if COVID cases are on the rise, what's the benefit of vaccination? I mean, I've told you the end time. Yee. Doc, you be here no say, must vaccinate. Now, man for vaccinating. Now, nipa say na vaccinating wo Ghana.
All right. So you need the 2 vaccines to be fully protected.
Yeah.
Now, so far, no, about those who are fully vaccinated, about 800,000. And drew 1 million. But just what also wouldn't say vaccine ninyano and why you didn't kakra my. Inti I feel no man penisi e be but mamika be chom. Most of the people we are seeing now, no, most of them haven't taken the vaccine yet. It is likely said the vaccine is good and it protects. Iti mpamucho say ebiba obia bomodina or bina ebwapa. If we are able to do the 20 million people na mapenyika no, there will be a friend of herd immunity. It means herd immunity.
Na 20 million beche nti sesi ayi de ene be prevention na
yambomode na yenya vaccines no bi ma ye nkrofo no.
Okay, na mo gm before no mo so mo de to aban nanim say omomode enya vaccine ni bi ma nkrofo
de bia ye ka na omuso omuguso.
Okay, Sandro, so this new wave of COVID-19 is just confusing us. You will think you have malaria, then boom, it's COVID.
Yes.
So
it is true.
Say symptoms. Me crowd by our boss in MC. Symptoms. They say malaria symptoms. Jay, wise man or say go shame. Doctor, thanks for your advice. Fellow Ghanaians, let's all contribute by following the protocols to fight COVID-19, to fight against the COVID-19. Regards to Richard John. Okay. Then who is there? Let me see. Emmanuel Odun, please ask him what are the possible fruits and other things that can prevent it. Hey, fruit is to me prevent. I did farmer for the mommy what no prevent.
It is fruit and prevent it. I didn't hear virus. It is preventing no is the barrier methods we are talking about.
Okay.
But what the fruits are? A man immune system no are stronger.
Okay.
Now so immune system no is stronger. Now a fighting virus no.
Okay.
It is good to eat fruits. It's good to drink a lot of water.
Okay.
It's good to have good sleep. Oh yes, how your immune system no is stronger. Now a fighting virus no. So.
I see. Afe mo ankasa mo hwe yen apomden adwuma yefo no. Mo so mo adwimu ne mo asetena mu o facility wo no etese afe mo tumi age atum say yade ide eja. Aya na ebegina no se sojafo ahwe o manfo no nti ye mo aboa ye ho masaike mo ho app.
Ya saike ye ho. Se ne o kan ti say sojafo say ye nya wo a. Sojafo weda ope o ubeko no akọ defend Ghana. To yeso health workers. It is our call. We have to do it.
Okay.
It is a psyche dream. And I can tell you, everybody is on board. Sometimes it's difficult for us, but we are ready to fight for Ghana.
Okay. Mo insurance na say ebi obi ye bi na onya o sayare na o fasunya COVID insurance package bi na those times no ye boy amane no eba.
But still, my people are still working. Well, we are still fighting. Almost a beba until we are on it.
Okay.
Almost a beba.
Until so being a bit of facility, I probably you may need being a beer. Monshesha yet to say ma ujuma yenino in line of duty no a contract.
Hey, so we treat them when they finish, they go home. When they are fine, they come back to work.
Okay.
That's it.
Okay. Doc. ye kwaso a ye so de mpa bo beta wachi wati na ya kasa a kire omanfo ne se omunhye na Jesus lin bi tete me wo se muda wubo no enkonkurase moje nkurase fo ada nkurase wo no eni ho kese wo.
Well, baby, but I think it's probably true. But Ghana Health Service are structured in such a way say every village is under a health management team. Okay. So indeed they are supposed to do it. So munya one in India and they're bearing microphone. But I think that everybody is supposed to do it.
Now yeah, the monitoring system.
But I think sir, most of the concentration is on the Greater Accra and Greater Kumasi because those are the hotspots.
Okay. Doc here that's pa. Dr. Winfred Ban doc, who the banner brofun kwa mankind in tape.
Me banner crumble.
So oh baby I don't know question. I see me the any yes no crumble ban. Crumble for so to ban
yeah to ban.
Oh I see. And Dr. Winfred Ban ono ne ban we nya kan for ban crumble ban. Oh yeah Greater Accra Regional Secretary Ghana Medical Association and I share apomudi and I share ye say apomudi adwuma ye for any apomudi adwuma mu so say yade eye kese a but doc say aye kese awie wo ma ho boa ne wo ma ho sisi no etesen nti wadawroma say the doc say aye kese awie sentence affairs na enka whole day bia eduru ba bi kwa na nipa miensa ene wo ho nom no de kolebu eye mfanto ho sisi e hwa ma efa nipa 18 omo afa omo no so omo de no emu eden anase emu ye den na ekosoro kese cheche say omo de ye betu omo foto o tinafie o hwe yiwe nom ye say ye from obisa wo omo say anope wo sori ye no mpomu tisen wanu munsu wutumi da yi ni ade no ewo fiefie nti die ni ti a watwam asem na wie ye ne tofa bone say covid no enkoye nti se wo kodai ugyae nose mask hye na say ya sign kofa nose mask no ehye obotom wa yifi obotom na hye na o hand sanitizer no so pebi to traffic ni mu na fa wade hye o bag mu na wo nkwa o wade ye kwa bai ko ba pa afi be di Ghana Hong Kong nti wadaroma twen ye basisia